Well, it sure wasn't a snow day in Frankfort, that's for sure. Major news coming from Governor Matt Bevin. Kentucky is the first state to get an okay for that Medicaid work requirement.
It is a national story, and Kentucky is right in the middle of it. Thousands of Kentuckians have to get help from Medicaid to live, leaving many to question what their future holds. Kentucky Governor Matt Bevin explained what to expect next. Our political editor, Chris Williams, is in Frankfort, spelling out how it will work.
He ran for governor on the promise, and now the federal government has helped him deliver. Today, Governor Matt Bevin announced the approval of the Medicaid waiver that he says will be transformational and a national model.
This is an extraordinary opportunity for us to chart a path that will produce the kind of results that are needed.
Governor Bevin rolled out Kentucky Health in front of cabinet members who'd spent 2 years scrapping Connect and pitching their plan to roll back the Medicaid expansion put in place by Governor Steve Beshear. From July through November this year, tens of thousands of Kentuckians will begin transitioning to a program that will require work or volunteering for insurance eligibility. An estimation of nearly 100,000 others will find they're no longer eligible for the health care benefits. The governor insists the disabled and others whom he says Medicaid was designed to help will not be adversely impacted.
The very people for whom Medicaid was intended, was created, and has historically been available are going to continue to have full and complete access to everything that they have had. And that isn't going to change one lick.
Kentucky Health's rollout is the first since the Trump administration announced this week that they would allow states to make the work requirement. Critics have accused the governor's plan of being dangerous. He pushed back, describing growing up in a family that faced similar financial hurdles to those who will be forced to face the new rules.
The worst thing that could have been done to me or to my family would have been to railroad us into a dead-end hole where there was no opportunity, where there was no expectation, where there was no incentive to be able to reach higher, to move through that dead end into, as was noted, a higher level of expectation and opportunity. This is good for the individual. It is good for the community. It is good for the workforce. It is good for the economy. It is good for Kentucky, and it's good for America. That's why I'm not worried about it.
Resources and a breakdown of how individuals will be impacted in the transition can be found online. We've added the link to our website as well as our social media sites. In the Capitol, Chris Williams, WHAS 11 News.
Now some more reaction. This new plan is not sitting well with many people, including the Democratic leader of the Kentucky House. He's Rocky Adkins, who said former Kentucky Governor Steve Beshear's previous decision to expand Medicaid saved lives, improved health, and put billions of dollars into our economy.
And he went on to say the waiver approved today risks those gains, puts them at risk, ultimately removes needed health care for up to 100,000 Kentuckians, and will almost certainly cost us more in the long run because of the added bureaucracy.